Process is quite convoluted. The therapists for an Olympic team is quite often chosen 18 months to 2 years out. So if you're considering putting your name up with a year to go, it's obviously too late. Now once you've got that experience with an Olympic team, the process is that the Australian Olympic Committee will contact each sport and ask them to put forward the names of the service providers that they have had working for them. So that includes sports physicians, doctors, physiotherapists, biomechanists, physiologists, nutritionists, psychologists, soft tissue therapists, and it goes on. So they will put forward all the names of people who have been working for them. So you have to be nominated by your sport to the Australian Olympic Committee. Hence you do not nominate yourself. What happens there is the number of people that eventually go to Olympic Games is determined by the amount of athletes that country has going to that Olympics. Australia, we do quite well. We're often in the top 5. I think we're always in the top 5 countries for the amount of athletes to go to Olympic Games. The more athletes that go, the International Olympic Committee will allow that country to take more administrators, coaches, and so on. So the more administrators that we're allowed to take, the more sports medicine people within that number we can take. What happens then is the Australian Olympic Committee will meet on a regular basis and shuffle the numbers and try to figure out how we can service all those athletes as well as we possibly can. And that happens in, again, quite a convoluted process. In general, what happens is there is 2 lots of people that get chosen to go. There is people that represent what we call the headquarters staff and people that go with individual teams. The bigger teams, such as rowing, such as swimming and athletics, will often get 1, 2, sometimes even 3 therapists assigned directly to that sport. So you as a soft tissue therapist may be assigned to go with swimming to an Olympic Games, and you will travel with them, you will stay with them, you will eat with them for the entire Olympic campaign. There is some sports like shooting, which often stay well away from the Olympic site, and they often have a person that will travel directly with them. Although they're a bit smaller, because they're so far away, they often have a direct therapist. There is also sports like cycling, BMX, cross-country and so on, and you will act as a soigneur with those teams, and they often have a direct therapist. And that can range from 5 therapists in Olympic Games all the way to 10, 12 therapists at Olympic Games. The people that get chosen for headquarters tend to be the more experienced soft tissue therapists, the ones that have travelled with numerous teams over a long period, so they know a lot of the coaches, they know a lot of the athletes, and a lot of those teams that don't get their own designated therapists can then come to headquarters to seek service from the soft tissue therapist. And it's the same with the physiotherapists and sports physicians as well. There tends to be around about 7 to 8 soft tissue therapists on a headquarters team. That's about average for what I've seen in the last 4 Olympics. And as I said, they're very experienced people, they've been around quite a long time, and their job is to service all those athletes that don't have a designated soft tissue therapist, and when appropriate will help work with the big teams like swimming, rowing, athletics and so on. When their therapists get quite tired, they might be sick, there's a number of circumstances where we'll have to help them. So the polyclinic is a multidisciplinary sports medicine clinic set up by the home country. And the people that work within that polyclinic can be just from that country, or they can be kind of from all around the world. It depends on the home country and what they want to do. For instance, Beijing, most of the people that worked in the polyclinic were from China. In Sydney, a member by the name of Jeff Murray, he headed up the soft tissue therapy services for Australia in the polyclinic, and most of the people that worked there were Australians. There were some internationals, but they were Australians. Now it's a voluntary situation. There's many people that work within the polyclinic, and the people you service, not the Australians, you actually service the countries that can't afford to bring their own therapist, or the athletes where they can't get in to see their own therapist because there's too many of them, too many athletes that is. So you'll be servicing numerous people from all around the world. So usually the head of service and the 2 ICs, so the second in charge, will travel up to 2 weeks early before anyone else arrives, and you set up the clinic. When I say you set up the clinic, you help set up the sports medicine clinic with the sports physicians, the physiotherapists and so on, to create an entire sports medicine clinic. That includes dragging in the beds, it means helping the docs with all their medications. Sometimes it's even putting curtains up, putting carpet down, so you certainly act like a tradesperson in that situation. And then the Olympics start. Now, initially there's not too many athletes there. They don't come in all on the one big plane. Often there's 2 or 3 athletes there, and then next day there might be 30, next day 100, next day all of a sudden there's 400, so it is quite staggered. Once the game starts though, doing too long of a shift, it's okay because you've got a lot of adrenaline running around your body in that situation, especially when you love sport. You can get through it for a couple of weeks, but the campaign is often up to 5 weeks, 6 weeks. So if you do work every day for long hours, you can get sick and you can get really tired, which really doesn't help your service provision and good quality service to the athlete. So what we've done in the last 3 Olympic campaigns is, depending on how many athletes are there, so we have all the information when athletes arrive, how many they're going to be, and we'll start bringing in our service providers according to those numbers. So we usually have 3 shifts. We'll have a 7 o'clock shift, sometimes that might be a 6 o'clock shift where it starts, and we try to keep people to 8 hours per day. So you might be working from 7 till 3. You'll have a mid-morning shift, so it might start at 10:30, 11, and those guys will go through to 6, 7 o'clock. And then we'll have a late shift, it might start at 1 or 2, and you'll go through to 10 o'clock at night. And you might have half a day off every 3 days. When we went to Atlanta, we had no days off and we were there the entire time. Although we loved it, we certainly were extremely tired by the time the campaign was over. So we try to give people some time off where they can actually enjoy the games. In Atlanta, I remember arriving home and I had to ask people what happened, because we were stuck in a room without a television and we were relying on people coming back to the Olympic Village to tell us how they had gone. So we've changed that up so people can enjoy the games and not just work for the entirety of it. You are working with an individual team, you'll travel constantly with them. So for instance, swimming is always on in the first week. They might arrive a week early. So the campaign is usually a couple of weeks with them at the games. You might have travelled with them previously to camps, so you might have been with them 6, 7, 8, possibly 10 weeks. And at the games you will be constantly there. You'll wake up, you'll go to the pool for training sessions, you're back home with them, you'll eat with them, you'll sleep with them, you'll go back to the training sessions until the games start. You'll be poolside constantly. When they get back, you'll be treating them, so the days can be really quite long. These people we have to look after and make sure they don't work too hard. And when the athletes do come back to headquarters, we're always there to help out where